Yeah, I've heard a few things about red light therapy, but I've never actually looked into it or done any research. And what's funny is that I told you I had a very busy day today, and I didn't have time to sit down and do research beforehand like I usually like to do. But I was driving down the road, and there was this sign on the side of the road that said, red light therapy now available at this location. And I thought that was really interesting. I was like, oh, I've heard about that, and I think I'd like to try that. And then I got to the waiting room at the dentist office, and I had a few minutes to like look up and see what we were talking about today. And I was like, red light therapy, this is wonderful. What an awesome opportunity and like alignment. So, yeah, tell us. I want to know all of it. I want to know about red light therapy, what it's good for, but I also want to know about you and how you got to doing all of this.
I appreciate that. So yeah, I've been a chiropractor since 1978. So we're talking about 47 years, give or take. And I was a hippie at the time. This was in the 70s when I first started. So uh, yeah, I was not money oriented. I got to tell you, I was structured in my brain. I wanted to help people, and I didn't mind making money, but I wasn't focused on that. And I'm only bringing that up because I'm happy to say that I was able to do all those years. I did make money, but I was really able to help a lot of people. But about 26 years ago, I was introduced to red light therapy. I was there was just a few of us. Some people call me a pioneer, whatever. I did write the book, Eliminated Healing, if you want to learn more about red light therapy, which is quite amazing. Um, and I don't make a dime from that book, so it all goes to charity. At any rate, so yeah, I was introduced to red light therapy by a relatively famous orthopedic surgeon and professor out of USC, and he brought red light to the country, and he was the first one to get FDA clearance and all that sort of stuff. And I knew him before that, and he said, "Yeah, shine a light on somebody, and it's going to make a difference." Now you got to know that at that time, I figured I knew everything. I'd been in practice 20 years, give or take, at that point, and it sounded crazy. Are you telling me I'm going to just shine a light like a flashlight on somebody's body and it's going to make a difference? And but he convinced me to at least try it, and we did, and it revolutionized my career, my practice. I was able to help people I never dreamt possible being able to help. So this lady comes over to me and she said, "You did such a great job with my brother's shoulder. Could you help me with my gum disease?" The only thing at that time we knew for sure was that it couldn't hurt anybody. So I said, "Let's try it." And we helped the gum disease. And then they have this guy with kidney problem, then this person with a ripped Achilles tendon that was certainly ready to go for surgery. And by the time we treated him about 5, 6 times every day until the surgery. And when they did the surgical review, he didn't need surgery. So I knew I was on to something here. It was quite amazing. And it was okay. I mean, it wasn't 100% back then because that device was thousands of times weaker than the device that we have now. And even yet and still, as you imagine, with the world of technology and as things become famous or uh, more popular, there's more money put into it. So the devices got stronger, devices got smaller, devices covered more parts of the body. And I was with it all the ways. I was really a major, I was really into it. But then about 13, give or take years ago, by accident, probably 14 years ago, by accident, they discovered that there was an element of red light that actually, which is uniquely, so there's two elements here that we're dealing with: red light, and near infrared. Those are the two components. When I say red light therapy, I'm talking about the integration of red and near infrared. We're going to talk a little bit more about that in a moment. But there was a company that only did red light, and my company only did near infrared. We were the first ones to do any of that stuff. And it was near infrared because we knew that was the most powerful, potent wavelength that would help people from a healing point of view. Again, at that time, they still didn't know exactly how it worked, other than that it couldn't hurt. There was a company out there that did only red light, which we knew was a mistake, but they're the ones that accidentally discovered that there was an element of red light that actually shrank fat cells. It didn't kill them. It didn't destroy them. It didn't freeze them, boil them, laser them. It didn't radio frequency or ultrasonic cavity them. So there was nothing about, all those things are about destroying fat cells. Someone has a notion in their brain that the word fat cells mean let's get rid of them. But really, if they had changed the name to something a little bit more elegant, they'd realize that fat cells are essential tissue. We don't, as a chiropractor, I don't want to put anything in the body that doesn't belong there. And I'm not interested in eliminating anything that should belong there. Even if we don't know what it does, I wouldn't want to eliminate it unless I was, and we don't think that the body was put together the way it is by accident. In fact, we believe in this term innate intelligence. And that innate intelligence means that all of the chiropractor's job and any doctor's job, in my opinion, is to just remove any interference and then get out of the way.
Mm-hmm.
So if someone has a cut, you'll want to clean it out. You want to put maybe some antiseptic on it, bandage it, and then get the heck out of town because the body knows what to do at that point, more or less. And that's the innate intelligence. I'm not getting religious here. You can believe in evolution. You can believe in God. Doesn't matter. There is this thing that the body has the knowledge to do what needs to be done as long as we get the heck out of the way. So we're not going to kill fat cells. So imagine if I can introduce somebody to a way of shrinking fat cells, not damaging them in any way, and just combine that with a smart diet. This is not a severe diet. Anyone can lose weight if they go on a severe diet, but they won't sustain, they won't maintain. And a year later, they put all that weight back on and more, maybe 6 months later. We want something that somebody can add to their lives and integrate it for the rest of their lives. There's very few people that know much about fat loss as I do. I was introduced to fat loss when I was probably 10, when my mother became an executive of Weight Watchers, and then I studied it. And yes, it ruined my life until I got the heck out of the house, because at that point, instead of spaghetti, we had bean sprouts. That just give you an example. But I really studied it, and I used it a lot with my patients, of understanding how to help them. And it ain't so easy. People that are overweight struggle with it. Sometimes they have, amazing need to eat, and on other people, they just have hormonal issues or whatever. So if you track their diet, not so bad, and they can't lose the weight.
Mm-hmm.
When you go on a smart diet, which means basically calorically neutral, and so if somebody who's a certain size, whatever, they need 2,000 calories a day to sustain and maintain, they will take 2,000 calories, but they have to be smart calories. So smart calories mean we're going to try to eliminate as much as possible the four things that get in the way. One of them is starchy carbohydrates. So that bowl of sugar that bowl of spaghetti that someone wants to eat, the body looks at it and consumes it like sugar. And no one would eat a bowl of sugar, right? But they're eating a bowl of pasta. And that doesn't mean don't ever have that
With
stuff
garlic bread.
with garlic, but have
Carbs for the
less of
carbs.
it. So starchy carbohydrates, number one, try to limit them as much as you possibly can. Simple sugars, that's an obvious thing. Sodas and alcohol. And alcohol is the worst. When you're on a diet and you're also drinking alcohol, that can't work. At least it's going to be more of a struggle. All right. So at any rate, so imagine I find out about this red light, and that's when I decided with some partners to get into manufacturing. We started manufacturing, let's say, give or take 13 years ago. We were involved with lasers, we were involved with pads, we covered parts of the body. And then COVID hits. And our practitioners wanted less physical contact between the patient and the provider, and we created the bed. And this is our latest version. My hand is gone. This is the latest version of the bed, but essentially is a lower bed with a top canopy that comes down onto the person. And we only did that as a substitute. You don't need staff with the bed. So the person can get in and out themselves. It's very easy.
Like a tanning bed. It was a tanning salon that I drove by that had the sign out front.
That had the red light.
Mm-hmm.
Yeah, a lot of tanning beds. Well, actually, our first bed was through a tanning bed manufacturer because they were struggling, and we convinced them to change the lights to our red light beds, which is integrated
Simple
red and near
change.
infrared. And I got
Win-win.
to tell you that within a month of us having delivered the first series of beds, it was unbelievable. I mean, we were getting feedback that was scary. I mean, this person had heart attack once a week, and now he's not. This person's having a stroke. This lady had a stroke. This person had this, that, this. We had no idea that it was going to have those sensational successes. And what we learned is since then is that when you bathe the whole body at the same time, head to toe, front and back, left and right, inside and out, that's when you're going to see these unbelievable results. And that's when we realize, well, we're onto something. Now, that first bed is ancient history now, as far as we're concerned. It had great features, but it also had some hiccups. So that was the Pro 100. We created the Pro 200, the Pro 300, the Pro 400. And now we're on the fifth version of the Pro 450. And the Pro 450, each of these gets, the essence of it is lights that are very strong, that can penetrate deep into the body and have a lot of success without getting hot.
Okay.
So the cheap stuff that most tanning bed facilities get, that gyms get, they're either fluorescent tubing, which is going to have minimum amount of success, or they get hot because they're using inferior equipment. So the essence of why some equipment is better and more expensive than others, really the lights are the most important thing. Strong, not hot. Why is hot a problem? It's not because it's uncomfortable. That's not the issue. When you put heat on the body, or, well, let's just talk about heat. When you put heat on the body, what it does is it dilates blood vessels on the surface, brings more fluid to the surface, and that would block the penetration of the light. Like a hot pack, when I go into the room and I take the hot pack off of the patient, their back is bright red. Well, that's a similar kind of thing. We don't want anything that's going to stimulate circulation in the person's body that would block the penetration of light. So, that's the most important thing is really strong without hot heat. And we'll talk more about that in a little while. But in essence, you're talking about, 47 years of being involved with healing people, trying to heal people as much as I could, adding red light therapy into my life. And like I said, having now results that are startling. And remember, in the 50 years that this technology has been studied by NASA, by a variety of other facilities, there has never been proven a recorded side effect. There's never been a recorded side effect. So you couldn't hurt somebody if you tried. So try it. If you have any ailment and you haven't gone for 6 visits, that's all it takes to see if it can even help you. 6 visits. That's 3 times a week for 2 weeks. It's 12 minutes a shot. And go into these beds that we have hundreds throughout the country. And I'm not in practice, so I'm not inviting you to my practice. I'm inviting you to learn about red light therapy for yourself. I am crazy about this stuff. In fact, one of my staff members made me this mug. Can you read that?
Get in the bed.
That's my attitude. Just get in the bed. 6 visits. The 6 visits will typically prove whether you're even a good candidate or not. Now, a lot of people will see changes even after just 1 visit. But by 6th visit, if we don't see any change at all, if the tremors of the Parkinson's don't lessen, if your eyesight, whatever, different variety of different things, then most likely these lights won't work for you. Or the facility forgot to plug the bed in. That's the only thing I can think of. I mean, we hardly ever see that where someone after 6th visit doesn't notice some change. I just wanted to tell you, when I start most of my lectures, and I'm going to be doing one in Dallas next week, where I'm live at a facility, early on, I asked the question, I want everyone to pretend like you're a health practitioner. And what would you do if someone called you up and said, I'm having a heart attack once a week, if not twice a week? And this has been going on for 12 years. So 12, 13 years ago, they had implanted a defibrillator in this gentleman's chest. And so every time he died, it would zap him back to life. But by the time we saw him, he was dying. Years and years down the road, his heart was not working well. So every tissue in his body was struggling for blood. It wasn't getting the blood supply. So his energy was gone, his clarity was gone, his tissues were struggling, his organs and glands and whatever. And imagine that person calls you up and says, can you help me? What would you say? I mean, up until the point of me now knowing about red light therapy, I didn't have an answer for that. I mean, he'd already gone through the whole medical route, drugs, surgeries. None of that worked. I mean, maybe it sustained him and prolonged his life to the point where he gloriously was able to get into one of our beds. So he got into one of our beds. And again, when I tell you this, I had no idea if it was going to help. The practitioner calls me up and said, should I even treat him? I said, just treat him for 5 minutes and stay in the room the whole time. Let's see what happens. We know the worst that'll happen is nothing. Let's see what happens. That patient goes home that night after just a 5-minute treatment. Normally a treatment is 12 minutes. Goes home that night, and that was almost 2 years ago. Hasn't had a heart attack since. Hundreds of heart attacks, no more heart attacks. Now he's had more treatment, but no more heart attacks. His energy's back. His blood pressure is normal. Everything in his body is coming or has come back to normal. And so now he has a vibrant, healthy life. That's what it's about. Bringing people who are on the edge of not doing so great. I was going to say death, but I don't want to get too morbid here. They're struggling, and now they're not. So something that we hear more than ever before, and we heard it occasionally before, but since this bed, now we're hearing more than ever, thank you for giving me my life back. We had a gentleman who couldn't walk for his Charcot-Marie tooth disease, which is a weird name for an autoimmune disease, which guaranteed him pain every day, guaranteed he couldn't basically walk for 15 years. And after 6 visits, he's walking, treadmill, walking his dog for the first time ever, because that dog's not more than 15 years old. And it's so much fun, For me, that's what I wanted to do always, to help people, take them from where they are and get them better. Myself, I'm 72 years old, and I get into bed 3 times a week, and I don't have a specific ailment. But I always taught my patients, it's like a candle. Your health and well-being is like a candle, or your life is like a candle that burns really bright from the beginning, brights all the way down to the end, and then sputters out and dies. Not where you have the last 20 years of your life where you're struggling, where you're in a wheelchair, you can't do anything for yourself. You're immobile, so you can't drive. You can't maybe communicate well. You can't wash yourself. You can't feed yourself. You can't wipe yourself. I don't want that. It's not about not getting older. It's about having the highest quality of life you can have as long as you can have.
Yeah, you for sure don't look 72.
Thank you.
And I think the only thing I did know about red light therapy is that it's supposed to help with the aging process.
Oh yeah, we
I
call
had
it.
no idea that it could heal. I had no idea that.
Well, you and I are not going to use. If I've used the word heal, I'm not supposed to use the word heal. So let's just say it's treat. We can't
Well,
use
I
the
use
word
the word
cure
a
or
lot
heal.
just in general because the podcast is about healing in all the varieties. And
Okay.
we're not necessarily talking about physical healing, but also the healing of the emotional state, the spiritual state, the community, the culture, society, healing, like we get over here, we talk about sustainability and earth grow, go green, hippie stuff. So it's
Well,
got a
let
lot
me
of,
tell you something about emotional and mental issues. I got an email not that long ago, and it said, "If this is how normal people feel every day, I can't believe I've been missing out all this time." So this lady, and this is just one of many people who have had great results with their depression, their mental attitude, PTSD, traumatic brain injuries, and things like that. Great success. So it can actually penetrate the skull and get into the brain and help that as well. And there's all this stuff. I'm going to tell you everybody where to go right now. Not well. I'm going to tell you where to go, but don't do it this minute. And that's go to Google Scholar. So it's scholar.google.com. And I'm going to send you these show notes so you'll have this so you can send out to people. If a person goes to Google Scholar and they get it on there, it looks just like Google, but it's the scholarly version.
mm,
And then put in the phrase red light therapy, enter, and you're going to get 3.5 million entries of double-blind studies, research papers, articles, all kinds of stuff about red light therapy. Then you can filter it down so you can put in the word lupus after that. You can put in the word sciatica, whatever. So there are 8 components to the divisions through our company, which is skin, phenomenal. I mean, we had a lady that had three forms of psoriasis. She had plaque psoriasis, glutate psoriasis, and she had psoriatic arthritis, which yielded dactylitis, which means that the morning she would, not every morning, but many mornings, she would wake up with her toes was swollen like sausages, and they were black and blue, and they were very painful. And after two visits, that stopped. After two treatments, that stopped. And then all the other stuff that she had, including all the psoriasis, the rashes all over her body, gone. So the skin's amazing. So it's about skin, fat loss we talked about, and I'll use the word healing loosely there. But it's also about men's health. That gentleman I talked to you about, the heart attack, within a short time, his erectile dysfunction was gone. So it's about skin, fat, and healing, men's health, women's health. With women, they'll talk to us about how the fact that they are so much better, their periods are less painful. They're, women sometimes at a certain age, they start losing hair. That stops. And it sometimes will actually regenerate. So we'll actually have a thickening of the hair. Then we go to the psychological stuff I just mentioned. And then I want to talk to you about our athletes. And then after that, I'm going to tell you how and why this works.
Okay.
Both fat loss on one side and for healing on the other side. So what I was going to tell you about athletes, if you have two athletes that have been competing against each other forever, and they sometimes this one guy wins, sometimes this guy wins, they're really close. Now this guy starts using the red light bed. I can tell you for sure, he will beat this guy every time, outside of injuries. But on top of that, so it builds up a person's stamina. It will build up their ability to run faster. I mean, we have beds with the NBA. We have it with the Olympic Training Center. We have it with, that was for track and field. We have it with major athletic facilities. And when the athlete gets in the bed early on, before their daily activity, they'll perform much better that day. And then they get in the bed again later that evening, and they'll recover from their day's activity. So when they wake up the next morning, they feel, as in quotes, fresh as a daisy. So I know it sounds like snake oil, right? It sounds like, well, what can't you help? And the truth of the matter is, you'd be hard pressed to find something that we couldn't help. Now, if someone lost a finger, we're not growing that finger back. I
Sure.
can tell you that. But my attitude as get in the bed, I don't care what you got. 6 visits, get in the bed. So before I talk to you about how it works, I just want to point out again, the book, I do recommend you check that out. I recommend you go to our website, which is trifectalight.com. And trifectalight.com is a great source of information. But also, if you want to try a bed somewhere in your area, there's a section there. You just click on that and request. One of our staff will find the closest office to you. And then on the other side of that same page, it's on the Contact Us page. It will be whether you're interested in buying one of these beds. Now, there are 2 reasons to buy the bed. One, you have more money than well-being. I suggest getting this bed for yourself, for your home. It's not cheap, but it's wonderful. But on the other hand, for a business, it's spectacular. It's a great magnet that will bring more people to your facility, because the kind of feedback that gets out there, we as chiropractors know that it's not satisfied patients that refer. It's excited patients. And you're never going to see more excited people than when you see people getting off this bed after a certain period of visits. I had one lady I was talking to, she fell in love with the bed. She has money. She's buying it for herself. And she said, because she had to travel quite a distance to go to the closest office to her. And she said, by the way, I referred 18 people to that location. I said, that's how you grow this business. It's the excited people can't keep their mouth shut, like me, and they just refer everyone they know, like me. My wife would have to tell me when we go to an event, she would kind of nudge me a little bit and say, could you just this time not talk about red light therapy? And I said, yes, honey, I won't. And then this guy next to me, not my fault, he's a mess. I mean, I could tell that we could probably help him. What am I supposed to do? Say nothing? Hmm. I said, at least give it a chance. Remember, it couldn't hurt. You couldn't hurt somebody if you tried. So you try 6 visits. And if you have an ailment and haven't tried 6 visits, I don't know how to say it. Are you crazy? I mean, I just don't understand that. Try it. So, with that said, let's talk about how and why it works and why it seems like it's snake oil, where there are
Okay.
so many different things. I know you want to say something, but I just want to finish that sentence. That there are so many things that we can help because we're covering the entire body. What were you going to say?
I need you to give me 5 seconds so I can throw my cat outside.
I'm sorry, what?
I'll be right back.
Okay, I'll be here, most likely.
Okay. So the snake oil stuff, yes, but also the science is bridging the gap that has been very vast for a very long time for a lot of reasons that we could really get into. But, you know, are you familiar with the chakras?
I am.
Okay. So
As
this
a matter of fact, this thing can run your meridian. So, um, we have actually seen acupuncturists have great success incorporating red light therapy with this.
yeah,
I
that's what
used
I
to
would
have lasers and different things. We actually ran the meridian. So you could actually hold the laser and run the entire meridian, whether it's
mhm.
the lower extremity or upper extremity or back or whatever. So I am familiar with that. But I just wanted to mention, I talked to you about how safe it is. But I also want to mention there are no real side effects. I'm sorry, no contraindication. In other words, who can't get in the bed? The only people we say don't get in the bed are pregnant women. So let me tell you why. In this country, in the United States, there's just too many attorneys, and they will go out of their way to find a reason to sue you. Now, if that baby comes out anything other than perfect, they're going to want to blame somebody for that.
Mhm.
That's one of the most litigious communities is parents of less than perfect children. And so we just say, look at, we know it could help the fetus. We know it could help the mother, but how about we just wait until she delivers and then treat the heck out of that mother right after delivery because she's going to love this, especially if she had a C-section. Her recovery will be unbelievable. So are you ready to learn how and why this thing works?
Sure. Let's go.
There are two completely separate mechanisms. One on this hand is fat loss. And that was only discovered a little over a dozen years ago. On the other hand, is everything else. Everything else I described and talked about, the healing from head to toe and all that stuff, that we're going to talk about in a moment. Let's talk about the easy stuff, which is fat loss. As I said, there was an element of red light. Again, when I talk about red light therapy, I'm talking about the integration of red and near infrared, but we're only now going to, for a second, talk only red light. There's an element and specific wavelength of red light. Again, these are elements of sun that can stimulate or can affect the fat cell wall. And what it does, what they found out, and this took a while, what they learned is that the fat cell wall, for a temporary period of time, becomes more porous and it allows the fat contents to leak out. It's as simple as that. Now, with our protocol, we move the fat away from the fat cell and eventually through the lymphatic system to the liver for use or elimination. Got it?
Mhm.
As simple as that. That's fat loss. So now let's talk about what I really want to talk about, which is the other aspect. Again, I can use the word healing because I can tell you go to Google Scholar and learn about it and go to the website and learn about it. But I have to be as myself, I'm a chiropractor and I have to be careful what I say.
Sure.
As a chiropractor, I don't have the license to say I'm a kidney expert,
Mhm.
even though I can help it
Mhm.
tremendously. So we had Janet she was stage 4 renal failure, which means that she was about to go on dialysis. And after a relatively short period of time with red light therapy, she's not. Her kidneys are fine. So how does the healing aspect work? So again, this dates back quite a long time ago when they first started doing research on it, but relatively more recently, there are some key words that I'm going to go over with your audience. And one key word is mitochondria.
Hmm.
So we know the body is made up of tissue, and every tissue is made up of cells, and every cell has one mitochondria in every cell, which, by the way, is not true. But that's what I learned when I was in school, that there was one mitochondria in every cell.
The powerhouse of the cell.
The powerhouse of the body, actually.
That's
So
what
it's the
everybody
reason why
thinks.
you and I breathe oxygen and eat food. And it creates this, what we call the energy currency, called ATP. And if you have ATP, you have the energy. You have the energy to heal. You have the energy to manage your life. And without that, you can't heal and you won't do well. So there's now a whole bunch of books, and there's actually a disease called mitochondrial dysfunction. They realize now how critical the mitochondria is. And the mitochondria is so prevalent in your body and so important in your body that it makes up 10% of your body weight. Look it up. It sounds outrageous, but look it up. The mitochondria is that critical. The mitochondria, when it's functioning good, you can heal from things, you can manage with things, you can have all the energy you need. And when it's not doing as well, you will suffer. It leads to disease and eventually death. And you can kind of easily reverse that with something that comes from the sun. What they discovered, that there are some elements of sunlight, not the bad stuff, not the UV light, not blue light, which can screw up the circadian rhythm, but
And your
elements
eyes.
of red and near infrared. And integrated, we'll call that, again, red light therapy. So what did they discover? So that there is, the sun can affect the body, just like you can see green grass and trees and stuff like that that are affected by the sun. We're also affected to a degree also by the sun.
Hmm.
And if we lived in caves and didn't have sunlight, we would be sick. So having sun is an important thing. Sunlight is an important thing. But the sunlight, when it gets to our body, is, be honest with you, it's relatively weak. And what we've done is we've taken four glorious elements of sunlight, magnify them many, many times, and drive it into someone's body, again, without heat. And that's why we're seeing these amazing changes. So what happens is that there are these elements called chromophores in the body that are receptive to sunlight or to light and will actually affect them. And in the mitochondria, there's an enzyme that is receptive to light called cytochrome C oxidase. So remember I told you I was going to go over a few words. Mitochondria, cytochrome C oxidase, which is stimulated by a certain element of sunlight that stimulates the mitochondria to come back to life. And that's why it's like snake oil, because every cell is involved. And when you bathe the whole body at the same time, as I said before, that's when we're seeing these miraculous changes, these miraculous results. So if you were to start with your hand in the top of your head and talk about hair restoration, brain, eyes, when a person gets into the bed, they keep their eyes closed and not wear goggles. So someone might say, well, isn't it dangerous? No, it's a light. If you can walk into the room, any room, and turn on the lights and not have a problem, which nobody would, then you can get in the bed. However, it's very bright. So you might not want to take a flashlight and shine it in your eye and keep your eye open the whole time. Keep your eyes closed. If I'm telling you the light can get through your skull and get to the brain, you know it can easily get through the eyelid to get to the eye, right? Now, why do we want to get it in the eye? So this one lady had uveitis, which is the pretty much similar to glaucoma. It's on its road to glaucoma, which is a swelling in the eye, which freaks everybody out. So she had uveitis. Her pressure in her one eye was 180 when it's supposed to be closer to 10. And it was problematic.
Yeah.
So the treatment for that was an injection in her eye once a month. And I asked her, and I'm going to send you these videos, and I do welcome you to send these out to your audience. This is from Jessica, who had so many issues with Lyme disease and shingles and kidney stones and just one thing after another after another. And one of them was also this uveitis. And she also was taking drops that cost her copay was $400 a month. Never mind that the injection was $5,000 a month. And yes, insurance paid most of that. And that's the problem with insurance. People don't recognize that what they're doing. Maybe they, if people knew how much it costs, how expensive it is to be sick, maybe they would think twice about the foolish things they're doing when they're younger. But at any rate, after a relatively short period of time, within a month, her uveitis is gone. And when you ask her, what's the pressure now? It's around 10 to 12, like normal. So, I mean, so anyhow, we're working our way down from the brain. We got to the eyes. When a person gets in the bed, we suggest keep your eyes closed and your mouth open. You want to get that miraculous light energy into the mouth. Gum disease, tongue, throat, tonsils, whatever. And then work your way all the way down through the whole body. And we're getting feedback that is just mind-boggling. So Steve contracted Lyme disease when he was 12. And it ruined his childhood. It ruined his education and social life. And of course, he had no career. It ruined it. Everything was and he wasn't in love with his life. This is the best way I can put it. He wasn't happy. So someone told him he should get into one of our beds, and he's on the East Coast. I don't remember exactly where. And he gets in the bed, and when he gets out, he notices no difference. And he just excuses the whole thing as a bunch of hooey. But 5 hours later, and ever since, it totally changed his life. So I'm going to be, when I send you those videos, watch the one from Steve. Now, when I send you these videos, they're on a spreadsheet. On the bottom of the spreadsheet, even beyond the spreadsheet itself, there is different pages in the spreadsheet. So there are one page is for patients, one page is for practitioners to hear what they have to say, and then another page is all this glorious, great videos that I recommend you listen to. Not all of them, but some of them. We just got one that we did on mood and depression and whatever. So it's called I remember, I think it's called Boosting Your Mood or something like that. At any rate, as you can see, again, I'm in love with this stuff. We know that it has to do with a variation of sunlight. We have 2 red and 2 near infrared wavelengths that we drive into a person's body. We can customize the treatment so that someone who's 80 pounds is not getting the same dose as someone who's 400 pounds, because this 400 pounder can absorb a lot more of this light without getting hot. This flesh will absorb that, and there won't be any heat. So we won't have to worry about blocking the penetration of the light. But the 80 pounder doesn't have as much flesh. So we would want to lower the power, but we can also pulse the wave. And we weren't always able to do that. By pulsing the wave, you create a resonating frequency. Now, people have heard about PEMF, different types of mats and ways of stimulating the frequencies in the body. And this one with the light is another way that we can pulse the wave. And with the resonating frequencies, we can enhance the results that we would otherwise get. So you want to have strong lights that don't get hot. You want the ability to pulse the wave with different frequencies based on the condition and the issue that the person has. You also want to make sure that the top canopy comes right down onto the person's body. Not the weight of it, but that it approximates as close to the body as possible. Because as you come away from the body, you lose power exponentially. You want the lights as close to the body as possible. So that's pretty much it. That's pretty much it in a nutshell, as far as how it works, why it sounds like snake oil, because every cell can potentially be affected. We talked about Lyme disease. We talked about, I didn't mention shingles, any autoimmune. We had a lady that had pretty bad rheumatoid arthritis, and she didn't have a lot of money any longer because she'd had it for a while. She wasn't able to work comfortably. And so getting in and out of her house was a difficult thing because she couldn't work the key to get in. So she'd have to knock on her neighbor. The neighbor would help her in there. Now, this lady used to be a professional dancer, and now she can't do any of that stuff. And after a relatively short period of time on the red light bed, everything's come back to normal. So she can easily use the key and get into her house. And all these other things have really turned around for her tremendously. We had one lady who had her Parkinson's was pretty severe, and the tremors drove her crazy. That was the thing that bothered her more than anything, even though there were many other conditions that she had. And it embarrassed her that when she went to church, she couldn't hold the Bible because the tremors were so severe. And after 2 weeks of treatment, she still had tremors, but they were so mild, relatively speaking, she was easily able to hold the Bible. So you can tell I have a million stories. I'm not going to go through anything else, but I just wanted you to see. Um, just my suggestion is try it. Look into the book, look at the website, try getting into this bed. I recommend it. Now, I want to recommend one other thing, and that's our YouTube channel. It's superb. A lot of the videos I'm describing are there. There are videos from professionals, there are videos from athletes, there are videos from ordinary patients. And so it's, if you go to YouTube, you just put in YouTube, you put in Trifecta Light Official, one word, Trifecta Light Official, and you'll see over 100 videos, and some of them are really superb. Anyhow, were you going to ask me a question?
Uh, you mentioned two different types of light earlier. It was infrared and near infrared. Is that correct?
I want to talk to you about the word infrared because that's an important thing. There is no such thing as just infrared. People use that term, but it's either far infrared or near infrared. Now, far infrared is what we commonly use the phrase. When a person says infrared, they're really talking about far infrared. And far infrared is a fancy way of getting deep penetrating heat, and that's it. It's not going to make any changes to the cell. It's the miraculous near infrared, which is a different wavelength range. So you have red, and then following that, you have near infrared, which is invisible to the naked eye. But we used to call it cold light because that range didn't get hot. Whereas the far infrared, that's what it's about. Far infrared saunas, far infrared, whatever. But as a shortcut, people just use the phrase infrared.
So that's what
So,
people want to look for is the near infrared.
well, you want to look for, I mean, I don't have an objection to far infrared, but not, you know, you can do, you're getting into far infrared sauna, it's comfortable, but it's not something that next day or 2 days later, you're going to see any major changes with you. As a chiropractor, we use far infrared to relax the body so that if I was going to do manipulation, it would be that much easier. But when you want the miracles, you're looking at near infrared. So you're all the red light equipment that's out there probably is using now near infrared. We started, my first company is the one that integrated red and near infrared. Remember, I told you red was not nearly as healing, but that was the one that had some healing, but it also was the one that we found could help with fat loss. And when you combine red and near infrared, as someone's losing the weight, for example, it tightens the skin. The near infrared tightens the skin, so you're not going to see sagging skins or stretch marks or any of that stuff. But if you have any skin condition, the near infrared is glorious for that.
Oh, cool. That's the only question I had.
So we talked about, you know, the difference between near infrared and far infrared. We talked about healing in general. Go to Google Scholar. Um, go to the YouTube channel. I'm going to send you the videos and a whole bunch of other stuff. And Google Scholar we talked about. Trying to think if there's anything else I need to talk to you about. Go to the website. If you're interested in getting a treatment in somewhere in your area, just click on it and it says if you're interested just as a patient, that's there. But if you're interested in pursuing this as a business or for your home, there's another section on that. So if you go to trifectalight.com and go to the contact us page, all that information is there. But also look through the website anyhow. There's a lot of good information throughout that.
All right. Well, cool. I don't have anything else. I think you covered it all. So,
I welcome all of you to try it out. And also, when you go to the website on the contact us page, you can send me, just send an email, and one of my staff members, if it's addressed to me, will get it to me. So you can just say, Dr. Rothschild, I'm asking you a question about blah, blah, whatever. And this is what I live for. I mean, I know it sounds crazy, but I'm not in practice any longer. And what I do all day long is help people understand better how red light can help change their life, but their business as well as their health.
all right. Well, thanks so much.
You're welcome. And thank you so much.